Assalamualaikum and greeting to all. I am Noraida binti Abdul Wahab from Family Health Research Center, Institute for Public Health. Today I will present translation and adaptation of the UNICEF Washington Group Child Functioning Module for identifying children with disabilities in Malaysia. For introduction, global child disability data are generally non-comparable, comprising different tools, methodologies, and disability definitions. UNICEF, in collaboration with the Washington Group on Disability Statistics, the Washington Group has developed a new tool on child functioning and disability to address this need. The new module consists of questionnaires for children aged 2 to 4 and 5 to 17 years on different functional domains, including hearing, vision, communication, comprehension, learning, mobility, and emotions. It requires translation and cultural adaptation for use in national household surveys of the Malaysian population. This study aims to translate and cross-culturally adapt the UNICEF Washington Group Child Functioning Module to the Malaysian context. For methodology, the cross-cultural adaptation followed the steps of forward-backward translation, evaluation of the translation by expert committee via focus group discussion, cognitive interviewing of the pre-final version with parents, guardians of children aged 2 to 17 years old from different ethnicities and socioeconomic status, cognitive debriefing, and finalization of the translated questionnaire. The procedures for translation and adaptation of the UNICEF Washington Group Child Functioning Module were based on Washington Group standard guidelines. For the results, adaptations were made after review of the translations by expert committee during the focus group discussion. Some adjustment made, for example, the Malay word sebaya are revised into sama umur. Second, bertutur are revised into bercakap. Third, orang di dalam rumahnya are revised into orang yang tinggal bersama di rumahnya. Secondly, cognitive validity of the translated child functioning module was determined through cognitive interviews. The use of cognitive interviews identified problems with survey questionnaire, translations, and offered recommendations for improvements. Several adjustments were made to produce an improved finalized version of the Malay translated child functioning module via a cognitive debriefing session. Some adjustments made during cognitive debriefing for each domain for hearing, attention, and coping with change. For example, the Malay word adakah dia menggunakan alat bantu pendengaran, the adjustment made was to include photo for hearing aid and flashcard as visual aids to illustrate the question clearly. Second domain, for attention, adakah dia mengalami kesukaran menumpukan perhatian pada suatu aktiviti yang dia seronok lakukan? The improvement was to bold word concentrating in English and menumpukan perhatian in Malay to ensure interviewers are able to identify the term concentrating and direct the question to the respondents correctly. For third domain, coping with change, adakah dia mengalami kesukaran untuk menerima perubahan dalam rutinnya? The adjustment made was to elaborate word rutinnya as shown in bracket. Rutinnya was not clearly understood by respondent of lower socio-economic status and need further elaboration for clarity. The use of cognitive interviews identified problems with survey questionnaire translations and offered recommendations for improvement. The Malay translated version of UNICEF Washington Group Child Functioning Module is now available for use to collect information on various types of functional difficulties among children aged 2 to 17 years in Malaysia. These data are important for the country and government in planning and developing better practices to improve living conditions and well-being of children with disabilities in Malaysia. Thank you.